So today we'll discuss about orientation on biomedical waste. So first we'll start with the definition of biomedical waste. Biomedical waste refers to any waste that is generated during the diagnosis, treatment or immunization of humans or animals or during related research activities. It includes waste that could be infectious, hazardous or pose risks to health and the environment. And this is particularly important in hospitals, clinics, laboratories or in research facilities. So whenever we are trying to diagnose any patient, like if we have to draw one blood, we are taking sputum sample from the patient, we are taking urine sample from the patient. So all these things are biomedical waste after we have run the samples. Similarly, if we want to examine a patient, so the patient has to lie down somewhere. Na? So the four things of general physical examination, after that we'll do systemic examination, so we'll do inspection, palpation, percussion and auscultation on the patient. So patient has to lie down, so the linen or the bed sheet over which the patient is lying down, that is again a biomedical waste. Then for immunization, so you know immunization vials, they will come in a vial. So we'll take on a syringe and then we'll draw the vaccine and then we'll push it into the baby or the adult, whoever we are immunizing. So even after the immunization also, the vials, the used vial, that becomes a biomedical waste. The syringe that we have used, that is also a biomedical waste. For blood collection also, before we are collecting the blood, we'll take one gauze piece or some cotton, we'll dip it in the spirit and then we'll use it. So that will have one or few drops of blood. So again, that used cotton is a biomedical waste. Again, the syringe we are using, that syringe and the vial container where we have taken the sample. So after we have run the sample, that sample is again biomedical waste. So whatever we are doing for diagnosis of the patient, for treatment of the patient, for immunization or in any research activities, during the research activities, so many biomedical wastes are generated in all these procedure. So most of the time it will be in the hospital, in the clinics, in the laboratories. So we need a proper curriculum that how to collect that storage biomedical waste, how to store it, okay, how to segregate it, and then how to send it to the appropriate place where the waste will be degenerated. Now some categories of biomedical waste. So it can be infectious waste. The material that contain pathogens like blood-soaked dressings, bandages and discovered gloves. So these blood-soaked dressings or the bed sheets or the dress that the patient has been wearing, so they are supposed to be in contact with the patient and patient is definitely infected. It can be soaked with blood or sometimes with body fluids of the patient. Then we must have used gloves during blood collection or sometime palpation of the patient or doing percussion of the patient. So all those gloves also, these are regarded as infectious waste. Then pathological waste, so that can be tissues, organs. Sometimes we are performing cholecystectomy, so the gallbladder is removed, so that organ. Then body parts and fluids such as bloods that are removed during surgery, or if the patient has unfortunately died, then during autopsy also we'll remove these organs. Why we'll remove those organs? Because we want to know what is the exact cause of death. So those organs, from that sections will be made and histopathological slides will be made. So under the microscope we will see various organs of the deceased person who have died and we'll try to know what was the reason that caused his death. Or any other body fluids, like sometimes patient might be suffering from pleural effusion. So any idea what is pleural effusion? So what is pleura? So it is the membrane that will cover our lungs. Okay, so usually it will have two membranes. So when water is accumulating, water or blood or any sort of liquid is accumulating in that pleural membrane, then that time we'll tell the patient is suffering from pleural effusion. So it is very painful condition actually. So we have to use one syringe and we have to aspirate the fluid. After that the breathlessness, the pain, it will reduce, and then from that fluid, sometimes it can be hemorrhagic, it can be clear liquid also if it is serous effusion. Sometimes it can be very thick pus-like material if there is a too much lung infection. So after we have done whatever investigation we intend to do, after that whatever sample is left, that again becomes a pathological biological waste. Okay. So similarly there is pericardial effusion. What is pericardial effusion? You can tell. Similarly like pleural effusion, you want to guess? Heart. Okay. So pericardium, it is the membrane that covers the heart. So whenever water is accumulating or any sort of fluid, blood or serous or mucus fluids is accumulating, that is called pericardial effusion. So all those body fluids, be it blood, be it pericardial effusion fluid or pleural effusion fluid, all these are pathological biological waste. Then there can be sharp wastes. Sharp means if we get pricked with that item, there will be bleeding. So they can be needles, syringes, scalpels and other items that can puncture or cut. So scalpels. So anyone want to guess in first year where you will use the scalpel? During anatomy dissection. Very good. So needles and syringes, sometimes for drawing blood, sometimes for drawing that pericardial fluid or the pleural fluid, even sometimes for pushing one injection to the patient or for pushing the vaccine in the immunization schedule. All these sharp items will be used, and after we have used the sharp item, all this becomes sharp biomedical waste. Then there can be pharmaceutical waste, the expired, unused or contaminated drugs or vaccines. So you must have noticed in all the medicines there will be one expiry date. So if the dates are crossed and the medicine has yet not been used, so they will become expired pharmaceutical waste. Contaminated drugs or vaccines might get contaminated. Sometimes from one vial there will be multiple vaccines. Similarly, for some time insulin also. Insulin is used for treatment of diabetes mellitus, right? So sometimes from one insulin vial there will be multiple injection. So if the patient who is using, if he is not conscious, then sometimes he might contaminate that vial. So those things also we better not put in the patient, and they should be discarded and they will be regarded as biomedical waste. Then there can be chemical waste like disinfectants, solvents and other chemicals used in medical facilities. So sometime, so we always in the clinics or in the labs, we have a bowl of disinfectant. So one of the most common disinfectant that we use in laboratory is sodium hypochlorite. So there will be one solution of sodium hypochlorite. So sometimes if anything is has touched with the infected blood or something, that thing will dip in the sodium hypochlorite solution. But after we dip it, that solution has become again biomedical waste. So there is a proper way how we should dispose that liquid also, and that is called chemical liquid waste. Then there can be radioactive waste. So waste that contains radioactive substances such as those used in radiotherapy. So we have a state cancer hospital near GB hospital. So there they are every day they are giving radiotherapy to the patients. So while giving that radiotherapy, sometimes some wastes are generated that are radioactive. And then in general, wastes are there similar to regular household waste, but it is generated in a healthcare settings. Like when I want to use that syringe, so it's inside one wrapper, no? So I have to tear that wrapper. So that plastic thing is very similar to our everyday day-to-day waste, but it is generated inside a hospital. So for that also there is a specific way where we should discard it. What is the importance of proper biomedical waste management? So it is very essential to prevent infection and injuries. So after I have given injection to one patient or after I have drawn the blood, there is a very sharp needle. So if I don't know where I should keep it properly, then there is a very possibility that the next person will get a prick, or who is taking the blood sample, he or she will get a prick. So we never want that. Then prevent infections also. Sometimes patient, they might have a cotton which is soaked with their blood or maybe their cuff material. So we don't want to touch that one, no? So because we want to keep ourselves infection free. So for those things, we need a proper biomedical waste disposal program to protect health workers as well as to protect public. Safeguard the environment from hazardous substances, because if we don't dispose them properly and if we throw them here and there, our entire environment will get infected, and from that healthcare personnel as well as local people, everyone will get infected. And also there is some regulations and guidelines, and it is always a good practice to comply with whatever regulations or policies has been made. So this is from Government of India, which was made in 2016. Later, some amendment were done in 2018 and 2019. So they have detailed about all the regulations about how to collect the biomedical waste, how to segregate it, how to send it, where to send it, who are the authorities who will look over whether the health workers or the hospital workers, they are doing it properly or not. Then for regular training of the personals who are directly or indirectly involved with these disposal systems. So for everything, there are rules and regulations that we should follow, and it basically came in 2016. After that, in 2018 and 19, some amendment were done. So whom these rules apply and whom they doesn't apply. So these rules shall apply to all persons who generate, collect, receive, store, transport, treat, dispose or handle biomedical waste in any form, including hospitals, nursing homes, clinics, dispensaries, even veterinary institutions, animal houses, pathological laboratories, blood banks, Ayush hospitals, clinical establishments, research or educational institutions, in health camps. Even when we are doing one health camp, there are also too much biological waste is generated, because we are going with some medicines there, we are checking patients there. Sometimes in emergency, we might have a facility to give some injection also. Then some health camps are not exactly health camp, but that polio immunization program, no, that is also one of the immunization programs. So anything related to health systems, be it a hospital, be it a nursing home, be it a clinic, a doctor's clinic, or any research laboratory, or an immunization center. So everywhere biomedical waste will be generated. So we should be very cautious. What do we do? So after the intended purpose is served, after I have given the injection, after I have treated the patient, after I have examined the patient, what do we do with the waste that I have generated in this whole process? Rules and regulations, they have set some definitions so that we find it easier whenever we are going through them. So biomedical waste treatment and disposal facility. So it means any facility wherein treatment, disposal of biomedical waste or processes identical to such treatment and disposal is carried out. So any facility where they are well equipped with how to process or how to destroy that biomedical waste, that is termed as biomedical waste treatment and disposal facility. Then handling in relation to BMW includes the generation, sorting, segregation, collection, use, storage, packaging, loading, transportation, again unloading, processing, treatment, destruction, conversion, or offering for sale, transfer, disposal or such waste. Means handling means So the way we are handling the biomedical waste, like how are we collecting it, how are we processing it, okay, how store, because every day it is not possible to send those waste to that facility. So we have to store it somewhere, and maybe monthly or weekly we will be sending this to the facility where it will be destroyed. Healthcare facility means a place where diagnosis, treatment or immunization of human beings or animals is provided irrespective of type and size of health treatment system. Management include all the steps which is required to ensure that biomedical waste is managed in such a manner as to protect health and environment against any adverse effects due to handling of such waste. What is the meaning of a occupier? So occupier means a person having administrative control over the institution and the premises generating the biomedical waste. Like if I am running one clinic, if I am running one pathological laboratory, then I am the occupier of that health institution. Then they have given some rules for me that how do I handle the biomedical waste that I have generated. So it can be a hospital, nursing home, clinic, dispensary, veterinary institution, animal house, pathological laboratory. It can be a blood bank, healthcare facility and clinical establishment, irrespective of their system of medicine. It doesn't matter what medicine we are practicing, any sort of medicine, but it will generate biomedical waste. And as a occupier, we have to comply with some rules and regulation that how do I manage that biomedical waste. And what is the operator? So operator of a common biomedical waste treatment facility means a person who owns or controls a common biomedical waste treatment facility. So operator is the one who is controlling the facility where an occupier will be sending the waste. Okay. So one is occupier, one is operator. And who is a prescribed authority? Prescribed authority means the State Pollution Control Board in respect of a state and a pollution control committee in respect of an urban territory. So prescribed authority means they will have a look on the occupier as well as on the operator, whether the occupier is collecting the waste properly and whether the operator is destroying the biomedical waste properly. So all these things are checked every time or in a given interval by the prescribed authority. So usually in a state, the State Pollution Control Board, we also have a Tripura State Pollution Board. It is located in Gurkha Boste area. So whenever we are trying to open one hospital or one laboratory, we have to go there, we have to fill up the application form, and then they will come and visit our center, and after that only they will issue the biomedical waste disposal certificate to you. Now, what are the duties of a occupier? So, who is a occupier? Occupier is the person who owns the hospitals or clinic where the waste is getting generated. Now, he or she has some duties. So, many duties are there. I have just written the important ones. So, an occupier must take all the necessary steps to ensure that biomedical waste is handled without any adverse effect to human health and the environment and in accordance with the rules that has been set up by the prescribed authority. Then the occupier should pre-treat the laboratory waste. So some of the waste is there, like let's say microbiological waste. So give some example of microbiological waste. Microbiology, usually what test we'll do? Culture. No? So for culture, most common samples are urine culture or sputum culture. Sometimes blood culture is also very important. So for microbiological waste or for blood samples, so we are collecting many blood samples throughout the day. So we are processing it. So after we have processed it, all this becomes pathological waste. So sometimes these waste need to get pre-treatment, some pre-treatment at the place of generation itself. So after the pre-treatment, we'll store it and then we'll send it to the for disposal to the actual biomedical waste treatment facility. So an occupier should know that how he should pre-treat the laboratory waste, for example, microbiological waste, blood samples through disinfection or sterilization on site. On site means in whatever place it is generated. in the manner as prescribed by the WHO or NACO. NACO means National AIDS Control Organization guidelines, and then sent to the common biomedical waste treatment facility for final disposal. Then an occupier should provide training to all its health workers. So if it is a laboratory, there will be technicians, laboratory technologists. If it is a clinic, there will be nursing staffs. So the occupier should provide training to those who are involved in handling of biomedical waste at the time of induction and thereafter at least once every year. It's not like that during the opening only they will give the training, but every yearly they should have a training to get updated that what all changes have come, what all updates have come in these processes. Then coming to duties of the operator. So who was operator? Operator was the one who was in charge of that final treatment care facility where the biomedical waste will get disintegrated or damaged. Okay. So an operator should take all necessary steps to ensure that the biomedical waste which is collected from the occupier, is transported, handled, stored, treated and disposed of without any adverse effect to the human health and the environment. And the whole procedure is in accordance with the rules and guidelines which is issued by the central government, or as the case may be, the Central Pollution Control Board from time to time. And the operator should also ensure timely collection of this biomedical waste from the occupier as prescribed under these rules. So every operator will give one format to the occupier that you should send the biomedical waste every monthly or twice monthly. So if the occupier is not sending on time, then the operator will notice it and he must report it to his prescribed authority that this clinic is not submitting the biomedical waste in the correct time. So like that, he can monitor all these processes. So you must have seen all these colored bags in every hospital you go, if you visit any doctor's chamber or if you visit any pathological laboratory. So usually there are 4 or 5 colors. So this one is most important. So yellow color, it can be the yellow colored bag. So these bags also have a specific dimensions, like how much thick it should be. There should not be any spillage, and or it can be such sort of containers. So what all waste we should keep in these yellow bins, or let's say yellow bags? So human anatomical waste, like any organ after operation, animal anatomical waste, soiled waste means if any bed sheet or linens, these are soaked with the blood of the patient or from urine or any body fluids of the patient. So all these soiled waste also will go into the yellow bag. Chemical waste, like I told, maybe the vaccine which is not used, like that. Then discarded linen, mattresses, beddings contaminated with blood or body fluid, microbiology, biotechnology and other clinical laboratory waste. So all these things will go into the yellow bin. This is the red color one. So here the contaminated waste which are recyclable, those things will go. Okay. So waste generated from disposal items such as tubings. Tubing means you have seen IV set sometimes, IV set through which the saline will go into the patient blood, or sometimes some injections they do come in a vial, maybe 30 ml or 50 ml. So for pushing those injections or pushing those salines, we need one IV set. So all these tubings, and then urine catheter you have seen. So urine catheter, so that is also one tubing set. Then bottles, intravenous tubes and sets, catheters, okay, urine bags, syringes but without the needles, without the sharp part. So you have seen syringes now, so we can detach the sharp part. So those syringes but without the sharp part, the nozzle thing, backwards things, and these things will go into the red container. Okay. So usually 4 color containers are there. So one will be yellow, next red, then there is one blue one, and then any other color you remember? So another one is white color. Okay, so white color is mainly due for the sharp object. Sharp object means needles. So sometimes that sharp container that also has some prerequisites that it must be this much thick, because we don't want that white container to get pricked from that sharp object. Then black color is also there. So black is for general waste. So you will see in normal day-to-day household also we are using that black colored container or black wrapper. So that is for general waste, but whatever is generated in a hospital settings. So yellow is the main one. Okay. So where human anatomical waste or animal anatomical waste or any chemical waste or soil things, beddings, dressings, those things will discard. Then comes the red one, where the recyclable ones, contaminated waste but recyclable ones, like the disposable items, tubings, bottles, IV tubes, sets, catheters, urine bags, syringes, but without needles, not the sharp one. That sharp needle will go into the white container. And vacuumainers with their needles cut and gloves. So surgical gloves also will throw in the red bins. This is the white one that I was telling. So it must be puncture proof, leak proof, tamper proof, because it is the most infectious and most complicated one, because it will have all those sharp needles and scalpels, everything will go into this one. So waste sharps including metals like needles, syringes with fixed needles, needles from the needle tip cutter or burner, then scalpels, blades, okay, or any other contaminated sharp objects that may cause puncture or cut. So for that reason, this needs to be puncture proof. So these includes both used, discarded and contaminated metal sharps. So this is the blue colored one that I was talking. So here we can throw glasswares, broken or discarded and contaminated glass, including medicine vials and ampoules, except those contaminated with cytotoxic wastes. And even metallic body implants also we should throw in the blue bins. So any example of metallic body implant you can remember? Huh? Pacemaker, very good. Pacemaker we can. Then sometimes in orthopedic OTs also, so some fractures, so then they will implant some metallic body parts. Now coming to the important thing, what are the different ways how we can treat and dispose the biomedical waste. So occupier will collect the biomedical waste, and they have a proper guidelines that which waste will go into what container. Then they have a proper schedule that the yellow container I must send every 2 weeks or every month, like that. So after he has sent it to the proper facility, then they have to decide that for what waste, which sort of treatment will be used. So there are multiple options. So one is incineration. So incineration means it will get burned in a very high temperature. Very high temperature, the waste will get burned. Then deep burial is also there. So where incineration facility is not there, maybe in urban parts, so they are deep burial. So deep burial means we'll bury it under the ground for human or anatomical waste, animal anatomical waste. Then for soil waste, so one of the option is autoclaving. So again, what do you do in autoclaving? There is a specific temperature, maybe 121 degree or 150 degree. Then there is some pressure point, that how much pressure we'll need for that burning. And some time period is also specific, for 30 minutes, for 40 minutes, 45 minutes. Usually it is for 1 hour, for 60 minutes. Then microwaving or hydroclaving. Hydroclaving means there will be one big layered vessel. So again there some pressure will be generated, some steam will come, and then there one motor is placed inside that big vessel. So it will disintegrate all the waste into small particles. After that, by steaming or by heat generation, that biomedical waste will get disposed. So microwaving or hydroclaving followed by shredding or mutilation or combination of sterilization and stirring. For expired cytotoxic drugs and items which are contaminated with cytotoxic drugs, they should always be returned to the manufacturer. So, usually in that waste disposal treatment facility, they won't have any facility for destruction of these things. So, it is advised that all these cytotoxic drugs, they should be returned back to the manufacturer or supplier for, and then they will incinerate it, and for that temperature is again different. It's more than 1200 degrees centigrade, so it is dangerous level of heat. Then there is plasma pyrolysis. So plasma pyrolysis means very hot plasma, very hot, maybe 156 degrees centigrade, like that. Very hot plasma is used for destruction of the biomedical waste. So I was talking about for microbiology waste or for blood sample, there are pre-treatment facilities are there that should be performed on site before sending the biomedical waste to the facility. So pre-treat or sterilize. So how do we pre-treat? With non-chlorinated chemicals, maybe sodium hypochlorite and some other chemicals are also there. And this is as per the NACO or WHO guidelines, that is National AIDS Control Organization or World Health Organization guidelines. So after we have pre-treated those things, then we will store them and send to the biomedical waste facility. So then they will incinerate all this waste. So then autoclaving or hydroclaving followed by shredding or mutilation or a combination of sterilization and stirring. So after we have treated this waste, so they will be sent to the registered or authorized recycler for energy recovery or for generation of the plastics. They will be generated to diesel or fuel well, or they can again be used for road making, whatever is possible. Then another method is dry heat sterilization for some of the waste. So again, some standards are set that for incineration, what is the operating standard? It will come how much temperature we should set, how much pressure, and for how much time we should set it. Then some emission standards are there, some stack heights are there, for how much height I can stack the waste before incineration. So for everything, for plasma pyrolysis, for deep burial also, how much deep should be the ground where we are planning to dispose the human anatomical waste. After that, after we have buried those waste, so from upside we must again put some soil or something. So what should be the length of that waste also? So everything is standard guidelines, everything is set there. So those the operator, they know it and they monitor it whether the proper guidelines are being followed. So for autoclaving also, for microwaving, dry heat sterilization. So for all the methods, some standards has already been set. Then who are the list of prescribed authorities? So who are the authorities that will look after both the occupier and the operator? So they are Ministry of Environment, then Central or State Ministry of Health and Family Welfare, the Central Pollution Control Board, the State Government of Health or Union Territory Government or Administration, and State Pollution Control Board. So if we talk about Agartala, Tripura, so the first, so our authority is the State Pollution Control Board. So then there one hierarchy is maintained. The State Pollution Control Board, they will report to the State Health Authority. The State Health Authority will report to the Central Health Authority. And finally, it is the Ministry of Environment, Government of India, who is looking after all the states. So these are some labels. So in every yellow packet, red packet, blue packet, we'll see those signs. Sometimes in quiz also, no, this biohazard won't be written. Only this logo will come, and then they will ask you people that what does this logo stands for. So this is biohazard logo, and this is cytotoxic hazard symbol. So sometimes in one box, if we are keeping all those expired medicines or vaccines, so those box will have this logo they will have. So these are the prescribed formats for the containers. So from whatever clinic or pathological laboratory we are sending, So we must note which day we are sending and what was the date that this waste was generated, the name, address, then waste category number. So all those bins, they are given some numbers. So number 1, number 2. So which number we have sent? Okay, so label, and this label should be pasted in the container or in the bags, and it must be non-washable, and it should be prominently visible. So whenever we are sending this to the operator, he just checks the label and he understands that this waste has come from that institution or that laboratory, and he knows that what treatment plan I should follow to destroy the biomedical waste. Okay, this much only for today. Thank you.